Hey you guys, so I am starting my third year of practice ownership and it has been an awesome ride, difficult at times for sure. One of the things that's been helpful to me is I don't have a coach or anything like that. I kind of just figure it out as I go along. If I can do it, you can do it too, that's for certain. And I'm just so thankful for everyone that has come to our office and benefited from the life-changing treatments we provide. Thank you for your trust and support. For my fellow dentist colleagues that are in that associate position or even people that are owning their own private practice, this video is for you. One of the books that I've been really enjoying here is called The E-Myth Dentist: Why Most Dental Practices Don't Work and What to Do About It. And it's been really an insightful read because Michael E. Gerber talks about working in your office, working as the dentist in your office, doing the actual dental work, doing the orthodontic work versus working on your office, developing the systems that consistently allow you to provide service to your patients and codifying that in a system that works. I've really been focusing on systems in my practice in the last 2 years. And the practice that I acquired and purchased and took over is an amazing practice, a smaller practice, and relied really heavily on the provider to do almost everything. There were some systems in place, but they were somewhat antiquated or outdated and they needed to be changed. Some were good, we kept, and some needed to be changed. And there are still many that we need to address. I would say that seems to be, from my perspective, one of the biggest differences from having a small office and a large office is the systems. If you're watching this and you are a patient, you're a consumer of dental services, there are generally many different types of dental practices. They come into 4 large categories. One is an academic or institution, like a university hospital-based system. Number 2 is a private practice, single doctor, like my office. Number 3 is a corporate dental office, a DSO. And then number 4 would be like a multi-specialty group practice. Nowadays, a lot of those are also corporate owned. So there are big differences between private dental practices and corporate-owned dental offices. And there's a lot of shade from the private doctors to the corporate offices because there's been a big influx of private equity into the dental space. There are big dental office chains that I won't even mention the names, but these are large corporations that some of them are publicly traded, they have stocks, they need to meet a production goal. There's usually a revolving door of assistants and doctors in that practice. They focus on high volume, they focus on production, and I think that, in my eyes, obviously not great for the patient because sometimes the experience and the outcome may be compromised for profit, whereas maybe in a smaller family-owned private practice, I think the experience and the outcome and overall reputation of the doctor and the office and the team is held much more delicately and is much more important. I would say certainly in my office that seems to be the case. Very important to me that I try to provide the very best services for our patients. The thing is, when I was an associate working at corporate offices, I also had that mindset. That's just who I am. I want to do what's right and what's best for my patient. The reason why I ultimately left corporate offices was 2 major reasons. Number 1 was that the volume of patients was so great and the systems so sloppy that we could not provide high quality care in a manner consistent with what I felt would be board standards. And so it got to a point where that just wasn't going to work for me anymore. I just couldn't continue to work in that kind of environment and provide the quality care that I wanted to provide. It just wasn't possible. The second was that the staff turnover was incredible and we would always have issues trying to keep the team together. So I think that in a larger place, maybe it's more difficult to do that. Now, in a smaller office, like a private office like ours, it's much easier to be able to provide the higher quality care and personal touches that we want to do. But it comes with a lot of administrative work and it comes with a lot of administrative systems and processes that, frankly, probably a large corporation is better at handling that. So yeah, it's a journey and developing those systems is one of my jobs, and it's not just patient care that I do. And I would say there's different balances and seasons to one's career, and it's always an exciting journey. So if you own a practice, thinking about owning a practice, this is a great book. Check this out. And if you enjoyed this kind of content, let me know about one system that you've made in your office and how that has helped change the course of your practice life. Thanks. Peace.